Hi. So I did my report on hypnosis for pain management. So, hypnosis is a state of consciousness in which a person focuses their attention to reduce their awareness and become highly responsive to suggestion. Through hypnosis, people have found that it can be used as an effective therapy to manage one's pain. In some cases, people even stated that through hypnosis, it eliminated their pain altogether. Hypnosis therapy was brought to light around the mid 1800s when people started noticing reports of patients having major surgeries while only using hypnosis for their pain management. Some examples of this is, in one case, a surgeon made an incision across the chest of a woman with breast cancer and removed the tumor as well as several other glands. And during the procedure, the woman conversed with the surgeon and showed no signs of pain. Another physician reported doing hundreds of surgeries while only using hypnosis and argued that patients experienced no pain. Hypnosis was even used in the Civil War by surgeons who hypnotized injured soldiers before amputations. The effects of hypnosis on acute pain. So acute pain is usually caused when there's tissue damage, inflammation, or a disease, and is only present for a certain amount of time that is usually less than 6 months. When it comes to acute pain, hypnosis was found to be less effective in patients than in chronic pain. That being said, hypnosis was somewhat found to reduce the intensity of acute pain, but only in some people because everyone is different when it comes to their ability to be hypnotized. Then the effects hypnosis has on chronic pain. Chronic pain can be characterized as a consistent pain for over 6 months that is somewhat resilient to medical treatment like arthritis or nerve damage. When it comes to chronic pain, hypnosis has been proven to reduce a person's pain. Most relevant studies have tested patients with recurrent headaches. Some have shown that hypnosis also helps with pain conditions like lower back pain and even cancer pain. Although hypnosis has been found to be effective in reducing a person's pain, the general consensus among studies being done on this subject agree that pain relief is the greatest when a person is high in hypnotic suggestibility. The mechanisms underlying pain relief are not yet fully understood by scientists, but in recent studies, research indicates that hypnosis can impact the activity in the spinal cord, the thalamus, the sensory cortexes, the insula, the ACC, and the prefrontal cortex. So the thalamus is considered to be the primary relay center for transmitting pain information from the peripheral and spinal cord to several sites in the cortex involved in processing nociceptive information. The insula is responsible for encoding a person's sense of his or her physical condition across various of domains as they relate to motivation, which is like the extent to which people feel pain versus feel physically content. Research suggests that the insula plays a leading role in triggering the pain network, and it can cause the subjective pain experience. Also, the insula becomes more active when there are threats to what the body needs for survival, like lack of oxygen or pain. Then the prefrontal cortex, which is thought to encode the cognitive aspects of both acute pain and chronic pain, including evaluating the meaning of pain, making executive decisions regarding how to best cope with pain. The ACC is referred to the affective and emotional component of pain and the motivational motor aspects of pain, preparing to do something about the pain, including the initiation of behavioral coping efforts. These areas and structures work closely together and also work alongside other central nervous system structures that produce the feeling we know as pain. These structures make up the pain matrix, and the pain is not experienced unless these areas are active. Activation of the peripheral and spinal mechanisms of nociceptive nociceptive is neither necessary nor significant to produce the perception of pain. Essentially, the brain holds the primary responsibility for if and how we experience pain. Most importantly, pain can be decreased or even eliminated when these processes are interrupted, and evidence shows that hypnosis can influence these structures. The hypnosis procedure involving cognitive processes is guided by a healthcare professional that is causing the mind to shift its focus away from the source of the pain, which is therefore reducing its importance and making the body's pain signals feel weaker. And then we're going to watch this video, Replacing Opiates with Hypnosis for Pain Treatment.
There's been a prejudice in modern medicine that the only real interventions are the physical ones, ingestion, injection, or incision. But this doctor is pointing toward a powerful therapeutic tool that is underutilized, the human brain. Using a technique called self-hypnosis, we can teach people how to powerfully use their brains to control the way their bodies feel and function. What is hypnosis? Well, an example comes from the Sochi Olympics, where unlike here in Davos, there was barely enough snow for them to ski on. They were only allowed to do one practice run. So what the skiers did, this is Bode Miller, was stand next to the course, look up, close their eyes, take a deep breath, and imagine every move, every turn, and it worked extremely well. The team got many medals. The field of hypnosis began with the Viennese physician Franz Anton Mesmer in the 18th century. I have used hypnosis with some 7,000 research subjects and patients and have devoted my career to studying what happens in the brain and how well hypnosis works. Hypnosis is a state of highly focused attention. The skiers at Sochi were just focusing on where they put their skis and how they move their bodies. That means dissociating other things that would ordinarily be in consciousness, fears about competition and competitors, for example. It also involves suggestibility, suspending critical judgment, so you don't judge and evaluate, you just do. We decided that to make hypnosis widely available, we had to understand how it worked in the brain. We studied people who are highly hypnotizable, not everybody is, and found that they had coordination in their brain between their executive control center that plans and does things, and a part of the brain that engages in conflict resolution and decision making. In fact, when we hypnotize people in the scanner, we found that we turn down activity in that brain region, which is also part of the pain circuit in the brain. So you spent less time worrying about what you were doing and more time just doing it. There are two other effects in the brain that we see when we hypnotize people. One of those effects involves linking the executive control region to a deep part of the brain called the insula that is involved in brain-body control, in pain and anxiety perception. So you have better control over your body function and perception. But we disconnected the brain from a part of it that is involved in self-reflection. So you no longer worry about what you're doing, you just do it. We Americans are in a lot of pain, as are people.
That is true. So, as we could see, hypnosis doesn't involve the use of magic or mind control. It's basically just learning how to use your mind and thoughts to manage unpleasant pain and reduce distress. So, in conclusion, the studies indicate that hypnosis is indeed effective and is a great tool to manage one's pain. It's obvious to see how powerful hypnosis can be for pain management, and that's why the use of a hypnosis is being more commonly used in the healthcare world today. And then I have some multiple choice questions. So, hypnosis therapy is proven to help what type of pain the most? It is B, chronic pain. Question number 2, which one is not something hypnosis can impact the activity in? The prefrontal cortex, the thalamus, or the occupational lobe? C, occupational lobe. Question 3. What is considered to be the primary relay center for transmitting pain information? A, sensory cortexes, B, thalamus, or C, chronic pain? It is B, thalamus. Question 4. Why was hypnosis therapy brought to light around the mid-1800s? A, it was being used in the Civil War to feel no fear in combat. B, it became a new trend teens were doing. Or C, people started noticing reports of patients having major surgeries while only using hypnosis for their pain management. It is C. I don't want to read the whole question again. Question 5. The general consensus among studies being done on this subject agree that pain relief is the greatest when a person is what? High in hypnotic suggestibility, low in hypnotic suggestibility, or like in a mild case, hypnotic suggestibility? It is A, high in hypnotic suggestibility. And that is it. Thank you for listening, and I hope you guys enjoyed it. Thank you.